Okay, so welcome everyone again. Thanks for joining today the webinar on how to approach policymakers. So our speakers today are two members of the Blue Circle Voices, Stella from Serbia and Vanessa from Brazil. They will be introducing themselves afterwards. So just a quick introduction from our side on how to approach policymakers. This is something very important. So not all of you will have already been involved in advocacy at the national level, but we think that everyone can actually do that. So even if you are not a professional advocate, even if you do not have a role in your member association, it's worth that you still try to contact policymakers. So the way we propose you to do this, probably you have seen already this document that IDF prepared like a year ago. It's an advocacy toolkit that we have prepared in advance of the UN high-level meeting on NCDs that is happening later this year. This meeting is happening in September. So we have had a campaign now for over a year, asking our members, the young leaders, and the Blue Circle Voices to advocate at the national level. But this toolkit, actually the information that it contains and the tips that we are giving, well, these recommendations are universal. Actually, you cannot only use it for the UN high-level meeting campaign. You can use it for any other campaign that you can think about, or just for punctual activities in which you want to involve policymakers. So basically, our recommendations are to try to establish face-to-face meetings. Normally, the policymakers, they have email addresses which are public, so you can just write to them, try to establish a face-to-face meeting, saying that you have some requests for the diabetes community. If you see that a face-to-face meeting is not possible, either because this person is very high level or because they refuse to have a face-to-face meeting, saying that they do not have enough time, you can always write a letter to policymakers that are relevant to this topic. People, for example, working on NCDs, on health, on diabetes in particular. Another thing that you can do also that can reinforce this approach to policymakers is speaking to the press. That way, your request will be known by a bigger audience, and you will have more people backing them. Another option always is many policymakers now have social media accounts, so they either have Twitter or Facebook or Instagram. So just try to search for them online, and you can always reach out to them. You can see here on the right two examples of tweets that we put together for the HLM campaign. So basically you tag them, and then you just say what you want to say about diabetes. So for example, the first one reads at and the person that you want to reach, 0% increase in diabetes, commitment is off track in, and you tailor that with the country of your choice. Check what IDF is proposing, and you add a link to that, and then you add the hashtags which are relevant. So you can find a lot more information on this toolkit. We invite you again to download that. You have the link in there. You just have to go to the IDF HLM webpage. And now we move already to our first speaker, Stella. So I am passing the control of the slides. Thanks a lot, Stella.
Hello, everybody. Can you hear me?
Yes, Stella, we can hear you. Sorry, I had muted myself. I mute myself again.
Okay, can we continue?
Yes, Stella, please go ahead.
Okay, I've been living with diabetes since 1976. It's 42 years and more. I'm 48 years old. I have insulin pump using for more than 50 years. Been volunteering diabetes field since 1997. My professional background is management. So if you're asking why I am doing what I do, because I was in the sales, I was in marketing, I was in such kind of business. So That's my nature. Unfortunately, was retired due to diabetes complications. I lost my sight on one eye. Presently, I'm Vice President of Diabetes Association of Serbia and, of course, member of IDF Warsaw Network. So I'm trying to move the slide. But nothing is happening.
Yes, Stella, you have to click on the slide with the mouse, otherwise it will not move. Try again.
Okay, sorry.
There.
Okay, sorry. First of all, you have to have a plan. When you are starting with anything, especially business like this, have a plan for lowering your blood sugar, have a plan for making yourself more physically active, blah, blah, blah. But when you're achieving something with the political world or with the people who are decision makers, you have to have a plan. And I suggest that you have a smart plan, specific, measurable, achievable, realistic, and time related. Try to meet those 5 topics when you're making a plan. 1-year plan, 3-year plan for yourself or your organization. Okay, when you are having a phone call or writing a letter, first of all, introduce yourself and your association, of course. Identify problems. You have to have 3 to 5 topics the most, and try to be concise. 1-page letter if possible, because if you are writing 3 or 4 pages letter, nobody will read it. Explain why it's important to have a meeting, propose a date and time, follow up if a person is not going to see you at the moment, so you call again and call again and call again and write an email again and try to set the date and time. And don't forget to say thank you for everything that has been achieved, for the time taking or whatever. Having a meeting. Please be on time. Be nicely dressed. Sorry. Sorry. What's happening? Be on time, nicely dressed, prepare everything. If you don't have enough data, you can use the Diabetes Atlas for data. Prepare your notes, your questions, of course, and answers you might be for the questions you might be asked. Focus on burning issues only. So we all have 150 problems, for example, but you have to deal with burning 3 or burning 5, and that's your focus on this 3 or 5 for the first year, for example. Be understanding, but also demanding. For example, you say, yeah, I understand that you have that you don't have enough money in your budget, but blah 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 blah. People with diabetes, if not treated well, they will consume every kind of money from the budget and things like that. Offer solutions. So you know what the problem is. Try to figure out what the person who is decision maker could try to change in order to provide better care for people with diabetes. And of course, be grateful for the effort and changes taken. When you're running a media conference, I suggest you to try to make it arrangements with a PR agency, if possible pro bono, because PR agency knows how to run the conference, run the meetings. They will also they can help you with social media campaign, with hashtags and things like that, with Twitter, Facebook, and other social media platforms. Set the date and time, prepare the press release, and the major journalist text that you should provide is to to cover simple journalist role. Who? Your association. What? Doing this and this. When? Where? In that square. Why? Because we like to do that and that. Involve all relevant stakeholders. So do not work alone. Always try to put people from the government, doctors, industry, and patients at one table. This is the only thing that can make you, that can provide you some results. Send invitations to all journalists covering healthcare, other associations that are doing a similar job, or they are tackled with diabetes, something like that, and follow up. Don't forget to follow up. Who is coming, when it's coming, and make a list of people, participants, and stuff. Be prepared for Q&A session and short interviews, because journalists always like to have something for their own media. When you're, whoops. Okay, what is happening? I'm sorry. I just clicked once. Okay, when running a media conference, try to that we have covered. Okay, build a strong partnership with the parliament. That's what we have done. Organize promotion of health lifestyles, blood glucose tests, diabetes prevention care, for example, during November or some other month. And diabetes is the leader among the non-communicable diseases. Don't forget that. And IDF has initiated both UN Declaration on Diabetes and UN Declaration on NCDs. And as you heard at the beginning of this conference, that the high-level UN meeting is going to be held soon. To identify champions within the parliament. For example, those people can be in a risk of diabetes or already having diabetes, or something like that, so people can understand you more and advocate for you within the parliament. Propose or organize a health board. We have a health board within our parliament, so we have these meetings with them on several topics that are really major for changing people's lives. In the parliament, what we have done is making blood sugar tests and advocates for healthy lifestyles. So we were not only testing people of the members of parliament, but also cooks and people who are cleaning and all the relevant people that are working in the parliament. So we're trying to suggest the healthy lifestyles, the changes in the diet, and they were always saying that they are sitting too much, maybe 12 to 13 hours a day. They don't have enough time to have a healthy and proper meal, and blah, blah, blah. So we try to figure out what can we do for them to have a healthier job, healthier life. And they appreciate it. So when you're organizing or joining a diabetes forum, conference, or congress, involve all, and please involve young leaders in diabetes. Young people have lots of fresh ideas, and they know how to help you. They would like to be involved. They are willing to be involved. Ensure media coverage or live internet broadcast, both is possible. It's marvelous. Speak about major issues. Use advocacy kits and tools, and use diabetes atlas. Offer possible solution, as I said earlier. Diabetes prevention and care is not a cost, it's an investment. That's something we are always saying. So you see myself here in on a forum using a model IDF or model of patient in the center. So you can, I have translated it to our language. You can also translate it to your language and use it. So if patient is in the center, then what we should all have. Oops, sorry. It's up. Okay. Evolve young leaders in diabetes. You can see here on the first left hand picture is Mr. Alexander Opicic. He was our first young leader, one of our, and he's now president of the Diabetes Association of Serbia. So, second young leader is Uroš Bogdanovic, who is also involved in IDF work with young leaders, diabetes leaders, and he was also representative of all people with diabetes within the European Parliament. And the third photo is also our young leader in diabetes, is Jelisaveta Fotić. Miss Jelisaveta Fotić, who was also talking to the Ministry of Health last year. So you have a lot of good young people who are willing to maintain what you have initiated or started, because in my opinion, some members of Blue Circle Voices, like me, for instance, are already tired and already have spent their time too much. But they can be supportive and they can help. But let young people do the job. And last but not the least is being a personality. This is Mr. Alexander Vucic. He was running for a prime minister in 2012, and we caught him there in the parliament and asked him to put the blue circle and to make a photo. Now he is the president of the Republic of Serbia. So these are some things you can do to be visible and try to draw attention of public to your cause. Thank you.
Thanks a lot for explaining your experience in Serbia. It's really great to see how how the people that collaborate with IDF, such Stella, such Vanessa, they are doing stuff in their countries. So now it's the time for Vanessa. So I'm unmuting her. Hello, Vanessa, and I'm going to pass you control now. Yes, and I'm going to mute myself back. Please go ahead, Vanessa.
Hi, everybody. It's a pleasure to be invited to participate in this web meeting. Stella, I loved your presentation. Congratulations. I think that my presentation will complement yours. I am going to introduce a little my work, that a person that I am. I have diabetes. When I was 17 years old to 18 years old, I chose journalism. I discovered that I have diabetes in university. I wanted to, when I chose journalism, I would like to contribute to a better world. And I think that I started in the diabetes, to working with diabetes, when I entered in a program of youth panel of Novo Nordisk to meet other young people with diabetes in the world to improve diabetes treatment. My engagement started when I was 24 years. After that, I started as a volunteer to help young people with diabetes in ADJ, in Associação Diabetes Juvenil in São Paulo. I became a coordinator of advocacy program with 30, the Brazilian Diabetes Association, with the mission to improve the Brazilian diabetes treatment. For this, each year we have a meeting with this public to establish an online social mobilization and networking platform which links regional young adult leaders, allows opportunity for the sharing of experience and best practice, and provides follow-up guidance in the fields of leadership and human rights advocacy for people with diabetes. Now they are trained to the right of people with diabetes, able to advocate for vulnerable people in their community. In each city, the diabetes associations began to relate to the health departments and municipalities. As you know, I am a journalist. I am specialized in health, and the work is to bring awareness around diabetes in the media, schedule interviews for doctors, nutritionists, and people with diabetes, especially on the World Diabetes Day. I am a member of Council of Associações Diabetes Juvenil, a member of IDF Blue Circle Voices too. Other work that I have that I have written 40 articles about diabetes to the site called De Bem com a Vida, and I write to the blogger for Convivência com Diabetes in Brazil. I organize events, and I am a speaker on behalf of 30 Diabetes Association in Brazil to improve diabetes treatment. I think that's my presentation, that's my work. I would like to, next slide, I would like to know if I could do this. Okay, thank you. The pictures that Stella, me, and the actress, I would like to call attention to everybody. You know, we aren't the same people, but we are equal because we need to love, to be loved. We have almost the same needs. So to work on the cause of diabetes, we need to talk to all people with a lot of respect. And we need to realize that no one is better than anyone. To realize that artists, politicians, religious personalities, we are equal. To advocate, we need to find ways to reach people to improve awareness in diabetes, how to improve access to proper diabetes treatment in the world. And this slide, I would like to show that's a kind of provocation because we didn't feel any fear to talk to anybody. And we need to say that we are equal. And I think that we don't be shy. To defend the diabetes all the time to everybody. I think that we need to inside this concept in our mind. I think that's very important to us. The next slide. Okay, thank you. I think that here I would like to show that we formed an advocacy group in 33 Diabetes Association in Brazil, and talked with lawmakers to pass bills that improve access to treatment. I need to show that we are trying to capacity this team every year to help the treatment in any cities that they are living. Next one. I think that we have many challenges, and it's not just Diabetes Association that we need to manage to bring together media, bloggers, to strengthen with the federal government. And we are going to organize an event that starts in Brazil, in AGJ, now in August, that we have a capacity to bloggers in the 18th of August. And we are going to organize an event to journalists because we realize that there are many mistakes about diabetes that they are published in many articles, in many posts, and we are trying to equalize, I don't know if that's a good word, but the concepts of diabetes. I think that's very important. But to try to advocate and convince people the importance of diabetes, we have to show the concepts of diabetes and the dates. And to success, to reach all stakeholders, we need to collect all the data to show how diabetes affects the population of our countries and the financial impact of the disease, so that people become aware of our cause. But for us to success, to reach all stakeholders, we need to collect all the data to show how diabetes affects the population of our countries and financial impact of the disease. And people become aware of our cause, that I leave sometimes to everybody. This date, you know, that the IDF atlas that we used in Brazil, and we need to show this impact of hospitalization, government expenditures, complications, and this kind of things that the coalition of journalists and the health ministry together with us, when we show this kind of thing and save money, when you show that the importance to prevent the diabetes in Brazil. I think that this example is good to everybody to do in many countries. And the next steps, that's a kind of tips that I would like to show to everybody. And gather data on diabetes, being a part of non-governmental organization, working with the engagement of bloggers and diabetes communities, aligning all communications with all stakeholders. As Stella said in other slides about the industry, it's very important, the government, bloggers, media, diabetes association, every stakeholders. I think that's very important. Approaching a parliamentary who has affinity for the cause of participating in events such as the public hearing and diabetes forum, and set up events that coordinate authorities to attend PAS in the parliamentarian's office and set dates to visit the Ministry of Health team with the guidelines to hand to discuss. Never give up on your dreams that you work with negatives. I think that's the messages that I would like to share to everybody about my presentation, that I think that's complement the presentation of Stella. Thank you to everybody.
Okay, thanks a lot, Veronica, for the presentation. So it's very important, as you have said, well, that you join forces not only with the other people in your association, but also with bloggers, with other types of association. It's important to that different people join. The more, the merrier, and the more power of action you have. So I'm not sure if anyone will have any questions, actually. So, well, this is the contacts of Vanessa. As you know, the slides will be on the website, on the IDF website. We will upload them in an hour or so. And you will also be able to listen again to this recording. So here is the email of Vanessa. If you have any questions for her, you can write her afterwards. But for the people that have joined us live today, has someone any question? You can just write on the chat and I will give you the floor. Okay, it looks like no one really has any question. Okay, so Thanks a lot to all the people that have joined today and to those that are listening another day to this recording. And as Vanessa was saying, you always have to try. You already have the know, so you can always try to contact these people and try to make a real change. If you have any question, as always, do not hesitate in contacting us. You can do that at advocacy@idf.org. Thanks a lot and have a nice afternoon, everyone.